Welcome to today's webinar. I'm super excited to have this conversation with you guys today. And the title is Game Clock Management Productivity Hacks. So there's a lot of rabbit holes I could have gone down today to talk about productivity and how I'm productive. I can really only share my experience with you guys to know like how I'm able to get a fair amount of work done. Got multiple companies, do a lot of advocacy work in chiropractic. A lot of volunteer work, and so people ask me like, how do you get so much done? And with that conversation and with those questions, Jenna and myself just had the idea that maybe this would be a good webinar topic. Maybe people could learn a thing or two about being more productive. We all could, even myself. But I think for at least my life, I feel like I've done a pretty good job of mastering my time so that I can get a lot of stuff done. During the week and yes, on the weekends too, because I do work on the weekends. So today's agenda, we're going to be talking about planning, getting more done in less time. We're going to talk about individual versus leverage contributor, and I'll define that a little bit later, but that's really driving productivity at scale. So what does that mean? It means the better leaders we are, the more opportunity we have to create more work product, more results, more positive impact. So we'll talk about that. Keys to outsourcing. We'll spend a little bit of time talking about outsourcing and why, excuse me, I've made a lot of decisions over the last several years to outsource a lot of business functions so that we could focus on the things that matter the most, which is really patient care delivery and outcomes for our patients and creating an environment for the rest of our team that makes it enjoyable to come to work every single day. And then lastly, the key drivers of results, and it's not always what people think. And we're going to spend a fair amount of time on key drivers. My team hears me talk about it all the time, and I know that we've got some team members on today, which is fun. But this is an area of opportunity, I think, for many business owners, whether it's chiropractic or otherwise. People seem to review lagging metrics a lot more than they understand the leading metrics or the key inputs to drive a result. So we'll spend a fair amount of time talking about that. Now, I've been told by colleagues and friends alike that my webinars is like drinking out of a fire hose. So I'm really going to try and keep it relatively short today. We're going to do about 30 minutes, and we're going to give you 1 to 2 key action items for each one of these agenda items so that you don't feel like you're walking away with too much information and also too many things to do. So try and give you some really actionable things that you can do leaving here today. So planning, calendar, and to-do. So this is my calendar. This is actually my calendar this week that I copy and pasted into this slide. And every single week on Friday and sometimes on Saturday and Sunday too. And again, that's my choice to work on the weekends. I love what I do. I love my companies. I love my people. And so I make a decision that I want to do work. But every single Friday, and again, sometimes on Saturday and Sunday, I'm reviewing my calendar to ensure that I know exactly what I've got coming up for the week. And then sometimes even having to move some things around in order to prioritize and reprioritize the things that are most important for that week. What I also want you to be aware of on this particular slide is if you see here where it says doctor one-on-ones and it says Sheldon and Jay, doctors one-on-ones, Kevin and Jay, doctor one-on-ones, Kirsten and Jay, doctor one-on-ones, Alan and Jay. So those are my one-on-ones with my direct reports, and they're recurring every single week, same time, same bat station, every single week. And so when I need to prepare for those meetings, I will oftentimes create a side-by-side calendar invite for myself to make sure I've got notes for that meeting to ensure I know exactly what I want to cover during that time. Now you can see other recurring, this little circular thing right here, the arrows, that also means recurring. This is my one-on-one with Jenna, 9 a.m. every Monday morning. Don't miss it. Like, I just don't miss it. This communication is really important when we start to talk about leverage contributors, but I just want you to see that the way that I get so much work done is because I'm very intentional about my calendar. I look at it constantly throughout the day. I prioritize the things that need to get done for the week and the day. And I make sure that I know exactly what I need to be doing and what needs to get done for those particular calendar invites so that I don't end up showing up to a meeting or showing up to a webinar completely unprepared. So using your calendar to organize your week, critically important. And again, these are things that work for me. I'm just sharing them with you. They may or may not work for you, but for me, it works extremely well. What I also want you to see is the amount of time that I block off in advance for my work, like the things that need to get done for me. So my tasks, my task list, my following up on emails, my time spent with members of the team that aren't necessarily a regular one-on-one. So my ability to actually block out time is really important. And this may look a little bit confusing, when there's like two things at the same time. So for instance, I know that my Fort Washington team is having their weekly level 10 meeting, and I'm doing this webinar. So I organize my calendar in ways where I can kind of have some insight as to the things that need to get done with my team as well. Not a lot, a little bit, but keeping the calendar front and center as part of my normal work week helps me stay incredibly productive and organized. Next is my task list. Now, I'm using Microsoft Outlook. So for those of you that this all looks familiar, I use Microsoft Outlook. And the great thing about Outlook is that you have this integration. So if I get an email and I need to actually set up a meeting, I can actually go to the top of the email and turn that into a meeting invite, and it goes directly on my calendar. Same thing with if I get an email and I need to do something with that email in terms of a task, I can turn that directly into a task and it goes onto my task list. Now, I'm a little bit geeky here because I like to see all the things that I accomplish every single day. So you can see last week, this is like my Friday, Saturday, and Sunday tasks that I completed. But knowing exactly what I need to be doing every single day is very helpful in organizing my week and organizing my day for that matter. Now, does it always work out perfectly? God, no. There are tasks that sometimes are overdue that I can't get to, that I need to move out to a particular, further out date. But the fact that everything is written down and is organized and I know exactly where to go to get the information that I need in terms of my work product is really important, and it helps me stay organized. So again, calendar and task lists, using my email to drive my tasks, using my email many times to drive my calendar invites and appointments, my meetings, make it very efficient for me. And again, it's not too often when I don't get my tasks done necessarily for a meeting, because I know it's expected. I know what I'm expecting of myself, and I need to get that done prior to that meeting or prior to the due date of that task. It happens, definitely, no question about it. I'm human, but for the most part, I'm pretty good, and pretty good is a relative word. I think I'm really good at getting these tasks done when they need to get done. If you don't have Microsoft Outlook, that's cool too. Like, you could use Google. Google has basically the same thing, and it's free, and you can create your Google Calendar where like other people can actually have access to it. It can be a shared calendar. You can have tasks, you can have your Gmail come through. So there's lots of ways to use free solutions that exist already. So if you're not wanting to use Outlook and you think Google might be a better option, you can also share documents on Drive, Excel documents or Excel type documents, Word type documents. All this can be shared on your Google instance. And so that also could be a great way to stay really productive with you and your team. I try not to be prescriptive with my team on how they work. Some people use Asana. Some people use Microsoft Teams. Like, I know Dr. Sheldon, who's here today, like, I know he likes and is actually very effective using Teams in communicating with the staff, especially during the shift, instead of email. I know my Fairfax team, Dr. Kirsten and her team, using Teams, and they talk about how great it is for increasing efficiency in communication. So again, there's lots of collaboration and productivity tools that are out there. You need to find the right ones that are right for you and your team, but these are some of the ones that have worked really well for us. So Microsoft 365, which includes Outlook, and then of course Excel and Word and PowerPoint, includes Office, but also Teams. My team really likes it, especially during the shift. And at the end, we might have a little bit of time for Sheldon to talk about his experience with that. And again, there's other productivity tools that are out there, but find the ones that work for you and your team and then implement them and stick to them, and you'll find your productivity will go up. Okay, next topic. This is one of my favorite topics. I talk about this with my direct reports a lot. And this is about the difference between an individual versus leverage contributor. And so I'll use my clinic directors as a great example. So my clinic directors are incredible individual contributors. they are seeing patients, they are getting their notes done, they are doing marketing tasks, they are doing the admin side, whatever needs to get done on the admin side. And they're also delegating a lot, which means they have to be a leverage contributor as well. They're actually having to leverage other people to run the practice. And I think, I know that as my leaders go from more individual to more leverage contributor, the results always improve. First of all, their experience improves because they're able to delegate and elevate others. They can actually help improve the skill set of the people on the team. So it's not just dumping work on people, it's actually giving them additional skill sets that they'll take with them for the rest of their lives. But also it helps them focus on the things that are most important in their job role. So while they could do a bunch of other individual tasks, why not delegate that to the team, become more of a leverage contributor, and let them build their skill set where you can focus, or the clinic directors can focus on the things that really move the needle the most for them as an individual contributor. So what about you? Like where are you as either an associate or as a business owner in your ability to create more leverage through the contributions of others? Now, I love this quote by Gandhi, and he said, a sign of a good leader is not how many followers you have, but how many leaders you create. And I will tell you, this is one of the most enjoyable parts of my job. I love knowing that we get great outcomes with our patients, and I don't see patients anymore, but my clinic teams do just a world-class job of driving great outcomes and experiences for my patients. And that's not an opinion. I mean, we've got lots and lots and lots of Google reviews and net promoter scores to back up that statement. But what I really also enjoy is watching people on the team grow and develop. And I think there's this notion, especially for young leaders, that once they learn something or hear something one time, that's enough. And the fact of the matter is that if you're going to create other great leaders, repetition is the key. Now, repetition, at least in our organization, has a structure. And we do, as you saw earlier on my calendar, our leaders do regular one-on-ones with the people on our team. I don't miss one-on-ones. I shouldn't say I've missed a one-on-one occasionally, but it is rare. Like that is one of the, if not the highest priority of my week, is to make sure I'm connecting with my direct reports. And we check in, how are you doing? How's your stress level? Are you doing okay? How are you doing with your goals? What are the issues that you're having right now, either with you or your team? And then what are the action items that need to get done moving forward? And many times it works out really well in terms of timing, because we will do the clinic level 10, or they will do the clinic weekly meeting with their team right after my meeting with them. So they're prepared and primed to go into that clinic meeting knowing exactly what needs to get addressed that week. The connection that you have when you do regular one-on-ones is really important. The relationships with the people on my team are very, very important to me. They're not just employees, they're like literally part of my family, because this whole thing, my companies are like my babies. And so that time spent is really, really important. I encourage my team, I'm laughing a little bit, but I encourage my team to do the same thing as me. Again, I try not to be too prescriptive, but do the same thing as me and get it on the calendar as a recurring calendar invite. Same time, same day, every single instance. So sometimes like my one-on-ones are every single week. Many of my leaders do one-on-ones every other week, which I think is fine, because they're having a lot more communication every single day with the members of their team. I don't have as much, but it's just important that it's the expectation that, yes, we're going to meet on Tuesdays at 2 o'clock, like every other Tuesday. And this way they're prepared, the leader's prepared, and everybody's happy. Again, I can't emphasize the point of communication enough. Regular, honest, and transparent communication, very, very, very important. These are opportunities for you to provide direct feedback to members of your team, especially if there are performance issues. It also provides your team member the opportunity to tell them, to tell you where they're struggling so that you can best support their growth and their success. So again, regular one-on-ones, very, very important. Okay, the third section that I want to talk to you about is outsourcing done right. So for many, many, many years, we had a large population of employees that did all of our billing. And the amount of headaches that I had with those employees were astronomical. And to the point where we had people that were actually stealing from us. One of those employees actually stole my credit card because I would give my credit card to buy the team lunch, and they actually used my credit card number and tried to purchase jewelry in Chicago. I mean, so like I have a bad taste in my mouth, but I think it's pretty safe to say that the more people that we're responsible in managing and leading, the more complex our lives become. And if we can outsource certain work to experts who can do it better than we can, who can lead better than we can in those instances, who can manage better than we can in those instances, it's probably worth looking into. So there are key areas for me that I've outsourced completely. So we went from having an in-house billing team to outsourcing it all to Genesis. Now I still have people on the team that actually have to do admin work related to accounts receivable, but it's not nearly as significant in terms of time, effort, and human resources as it was prior. So the billing team is responsible at Genesis for driving our revenue, but there are things that we need to do inside of our company in order to ensure we've got clean claims, demographics are correct. We handle all of the personal injury and workers' comp attorney cases. So we do that in-house as well. That's not something that we felt like we could outsource because our relationships with our referral sources are really important. And we didn't think that an outside source could really manage that relationship as well as we could. So we were selective in the things that we decided to keep. But I will tell you that working with Genesis, and of course we switched over to the EHR as well, has been a godsend. Like it's been one of the best decisions that I've made because again, we could focus on the things that really matter and we didn't have to worry about staff members not showing up for work and not doing their job on the accounts receivable and not following up on claims that directly impacted our cash flow. The great thing about Genesis is, and this is not a commercial for Genesis, but I do love them. The great thing about Genesis is that they are paid based on how much they collect. And so they're incentivized to bring in as much money as possible, just like we are. We want that money to come through the door for the value that we're creating. And so it's just been a very good beneficial relationship. The next company that I'll talk about is Empower. So we had in-house HR. It was okay for a time, but nobody on our team was truly an HR expert. And if you've got a team of, I would say, 10 or more people, outsourcing HR is probably a must. This is a risk management issue. If a chiropractor who graduates chiropractic school thinks he or she can manage HR without having any sort of formal training in HR and up-to-date training in HR, you're putting your practice at risk. We are delighted, again, one of the best outsourcing decisions that we've made. We are delighted to have all of our payroll and all of our HR outsourced to Empower. And I think it's important to understand that HR is not just about payroll or benefits. HR really is about strategic human capital management. How do we lead our people? How do we drive engagement? How do we make sure that if they're having an issue, either intrinsically, just they're having their own issue, or they're having an issue with their manager or someone else on the team, that it can be addressed appropriately with someone who's an expert in HR. I'm not an expert in HR. I don't do HR for a living. So the fact that we outsource this, it's really, when it comes to cost, it's not significantly more than what we paid for our payroll company just to process payroll. And the resources, they're them looking at our employee policy and procedures document, our manual, onboarding assistance, payroll assistance, like it's just been a godsend. So I would recommend that if you've got 10 or more employees, whether it's Empower or anybody else, look at outsourcing your HR because your practice is big enough that you're probably putting yourself at risk. If you're interested, feel free to reach out to me. I'm happy to make these introductions, whether it's Genesis or Empower or anybody else on this slide. These are just examples. I have no pony in this fight. Like I don't get paid from these people, but this is just my way of sharing how we've outsourced successfully. We have in-house social media, Emily, who's just phenomenal in her job, and Kat, who is her direct report. Like Kat leads Emily. Kat's our director of integrated operations. Many of you may even know Kat or have met Kat. She does an amazing job. Emily does an amazing job, but there are certain things that we are not experts at as it relates to our social media strategy. We have certain goals that we have not met And so we are working with Archer Hit Your Mark Media, who's built our Kaizenovate website and made some improvements to our Kaizo Health website, built our Kaizo X website, and now we're using them for some social media strategic initiatives. We want to drive more new patients through a certain category of payer mix. We're going to work on that. We want to drive more fitness clients in our fitness division. We're working on an initiative for that. So, but we're outsourcing that work because from a cost and time perspective, and most importantly, from an expertise perspective, we don't know this. So if we can find someone who's going to give us a fair price and deliver results, that's what we're going to do. And that's what we've done with Archer Hit Your Mark Media. I can't tell you the number of people that have referred to Derek. He's fantastic. It's Derek Archer is his name. But outsourcing that work that we are not world-class at is really going to help us grow our brand even more. Now, we've already got 11,000, maybe even 12,000 followers on Instagram at this point. So we're not stopping what we're doing in-house because, again, Emily has done an amazing job. But we want to expand our reach. We want to expand our market share. So bringing somebody onto the team as a partner with us who knows that stuff is a strategy of ours that we're pursuing. So I'll keep you guys posted on the results, but I'm sure they're going to be fantastic. And then lastly, finance. I had someone in-house who was doing finance for a very long time and she did a good job. But what I've realized is that outsourcing this to really an expert, more of a CFO expert, someone who can not just look at the financials, but also strategically look at the financials and say, these are the things that we need to do. This is how we set up bonus structures for your clinic directors so they can win. You know, these are the elements that I'm not capable of doing myself, and the in-house person wasn't capable of doing it themselves, but someone who's a CFO, who's an outsourced CFO for many, many, many other companies, who knows how other companies work and are successful financially, has been instrumental in helping us be successful financially as well. So we use LTBD. Tim Hawkins is the CEO. He's our outsourced CFO, and he and Linda, who's an accountant on the team that's assigned to our business, they just do an amazing job. They're doing this for multiple companies. All of our clinics, which are separate entities, our research foundation, our fitness division, our technology company, and they crush it. You know, every month I get financials that I'm able to share with my clinic directors because they're doing not only a good job in terms of the time, like we get it pretty close to the end of the previous month, but the data is accurate. And so when you have accurate information, you can make better decisions. And that's strategically, that's key for us. It's key for any business when you have accurate financial information, because those strategic decisions are really important. Okay, so I'm running a little bit behind, and I want to talk about, lastly, the key drivers of results. So the people on my team that are on this webinar today, they're smiling to themselves because they literally could teach us. I could get Sheldon or Jenna, who are on this webinar today, and I guarantee you they could teach the section because I drive it home all the time. Again, think about this. I've said this earlier, be organized, have your one-on-ones regular days and times, and you've got to repeat your messaging. And you know, when you say something over and over again, it sinks in and people understand. I literally just did a one-on-one with one of my other clinic directors, and he's telling me exactly how he's going back and looking at the key drivers and the data behind a specific result that he wants to improve. I'm not saying a word. He's telling me exactly what he's doing. He understands the key drivers of results because we've had so many conversations around it. If we didn't have regular one-on-ones every single week and me talking to him about this and us discussing it and helping him understand why this is so critically important to get the results that we're looking for, he wouldn't have been able to do that today. I was just sitting back and smiling. I was listening to him. He knew exactly what he needed to do. I didn't have to say anything. And he was getting ready to go into his level 10 with his meeting and crush it. Like he knew exactly what needed to get done. And so key drivers of results is something, again, I talk about all the time, and I'm going to share with you why this is so important. So remember the title of this presentation, right? This is game clock management. This is productivity hacks. And when business owners or even business unit managers and leaders don't get the results they're looking for, many times it's because they're chasing their tail. And they're chasing their tail because they're waiting for the results to occur and not thinking about the key variables that must be controlled in any given process to drive the result that we're looking for. Now, what we're talking about is Six Sigma. And maybe in a future webinar, I can discuss Six Sigma in much greater detail. But Six Sigma is how large organizations run. Companies like GE, Motorola, large healthcare systems implement Six Sigma, because they understand that for organizations to be successful, they must understand the key drivers of results. I don't know about you, but that cat is totally making me dizzy. So I want to focus in, because I could talk about this all day, all month, all year long. I want to focus in on one thing, which is visits, kept visits, because visits essentially is a direct relationship to care plan adherence. When patients understand their diagnosis, understand their treatment plan, are aligned in that because they understand we're working to help them achieve their goals, not ours, their goals, they're much more likely to be adherent to the care plan. And why is that so important? Well, fundamentally, if you don't care about care plan adherence, then you don't care about your patients, right? Because I care about care plan adherence because I want them to get the best result. I want them leaving our clinics and saying, that was the best experience I ever had. I came in with these symptoms and I'm leaving without them. And by the way, I feel very confident. I feel confident that the likelihood of these things reoccurring is significantly lower because I've completed my care plan. I know that I'm functionally better. I can do a squat, I can do a lunge, I can bend correctly, I can do these functional movements without hurting myself. So care plan adherence is something that I'm passionate about, and this ties directly to another interest of mine, which is really behavior change, because that's essentially what we're asking our patients to do. Now, when it comes to understanding key drivers of results, and I did a quick 2-minute drill. You can go back to our website, the kaizenovate.com website, and you can look at this. I went through it pretty quickly, but you've got to understand the key drivers of results. So if we're talking about visits here, these are some of the elements that really drive kept visits. How many patients on the schedule don't have any future appointments? How many self-discharges do we have every week? How many future visits are scheduled for next week? And how are we doing scheduling out our patients, our new patients to their treatment plan? And by the way, how do we be innovative and use patient engagement technology to gamify the patient experience? And this is, if you've heard me talk before, either live or on a webinar, and you know about our technology company, like this is what we do. This is what we specialize in. Now, again, we can do another webinar talking about billings and revenue and profit and expenses and all of that stuff, but we're going to hone in on visits today. So remember, we don't want to be chasing our tail around just the result that we wanted to get, but we didn't get. We want to be able to be like this dude, the cool cat, and know exactly what we need to get done because we understand the key drivers of results. So let me just say this. If you're not measuring it, you can't improve it. And I'm going to say it one more time. If you're not measuring it, you can't improve it. And even recently, I've had conversations with people on my team and they'll make a comment. I'll be like, well, what does that mean? Like specifically, how do we measure that? Like, oh yeah, I'm doing a better job. Well, how much better? Like specifically, how much better are you doing at making sure we're getting Google reviews? How many patients are you talking to versus how many patients you had the opportunity to talk to? Like, I'm relentless about this. And I know the people who are on my team are laughing right now, but I am relentless about this because you can't improve it if you're not measuring it. So every single week, this is what happens in our clinic team meetings. Each one of our clinics, our technology team, everybody runs our operations team, our marketing team, every single team and across all of our companies run level 10s. So we have a very specific agenda, and part of that agenda is scorecard. So these are the results that we're getting. You can see there's many, many, many variables here. We collect a lot of data every single week in our company. But specifically for the purpose of this discussion, and this is our Rockville clinic, Dr. Sheldon again is on this webinar, what we're looking at as a key driver of future kept visit results is no futures. How many patients at the end of the week are on the schedule that don't have any future appointments? And the goal is to be 8 or less. Now you can see that we've had weeks where we've ended with 5, 4, 9, 5. Last week wasn't a great week. We had 15 patients that didn't have any future visits on the schedule. Now, there's more to this story. I'll tell you how we monitor this on a proactive basis, but at least we know where we stand. We're not waiting to the end of the week and be like, God, our visits went from like 150 to 100. Where did all those visits go? No, we're thinking about the key drivers of the results. And we know that if a patient who should be scheduled next week and is not because there are no future, they don't have any future visits scheduled, we know exactly what steps need to be taken in order to address that. Have a conversation, call them, text them, email, whatever our process is. And it's the ops team and the clinic teams that manage that. So they have their process. Whatever that process is, it gets executed and we change the results. So key drivers of results, I'm going to take a little bit of a step back and I'm going to share with you just other things that need to get done in order to ensure we're driving kept visits. So report of findings, right? Now this is our report of findings sheet. I think I have, yep, I'll share in detail a little bit more about that with you, but like explaining to the patient the why. Why are we making the recommendations that we're making? Yesterday in our Rockville clinic, we talked about the Simon Sinek video, Start With Why. It's actually, the title is How Great Leaders Inspire, but his book is Start With Why. And so we have to explain the why. And guess what? The patients need to tell us their why as well. So tying their goals to what we know clinically is going to be most meaningful to them, coming up with shared decision-making, like this is what we think you need. And then the patient may say, this is what I want to do, but I can't. Okay, well, this is what we can do collectively. This is how we're going to schedule out your entire treatment plan at the beginning, which by the way is flexible and it's pliable, but based on what we know clinically and our experience, based on what we know from the evidence, like the dosing studies by Haas et al., based on what we know from the clinical practice guidelines, we're going to set you up for this range of appointments for this treatment frequency and duration. And like we tell them that, and I'll get into a little bit more detail in just a second. What also drives kept visits is their experience and their outcomes. Look, if you can't demonstrate in the first visit statistically, and this is across all chiropractors across the entire country, and this is from Optum Health, United Healthcare's data, we know that the most common mode, the of the number of treatments that patients attend a chiropractic office is one. Many patients only come in for one visit and then they never show up again. And so like we're very focused on providing an evidence-based report of findings, understanding what their values are, what their goals are, and how we can come together to come up with shared decision-making to get them to commit to the treatment plan that we're suggesting to them. And by the way, I will just say this for the record, and you know, if Sheldon has an opportunity to speak at the end, he can talk about this, but like nothing is cookie cutter. Do we have gold standards that we want to apply based on the evidence? 100%. Some patients need more, some patients need less. We would never tell every single patient, and I would never tell my staff to do this, that they need X number of visits. What they need is to address their condition with both treatment frequency and duration that meets the clinical practice guidelines and the dosing studies. And what we know from those two elements is that frequency in care, especially early in care, matters. So that's what I expect from my team. That's what they want to try and drive home to the patients, but it all depends on like what they can do and also what we can handle in terms of capacity. Because sometimes our schedule is too full and we sometimes can't meet their demand, meet their need as it relates to frequency as well. And then how we schedule out their future visits is really important, and that's a key driver of results. And I'm going to show you how we measure that. This is our report of findings sheet. And then, you know, again, this is really about educating the new patient on what slows recovery time. Why are we making the recommended frequency and duration to them? We talk about the different phases of care. In fact, Dr. Sheldon and I were talking yesterday, like maybe these names are not great, like on our report of findings sheet. Maybe we need to change it. That's more patient-centered. But nonetheless, we have phases of care that we talk to them about, which is basically helping them get out of pain as quickly as possible, advancing their care with functional correction, and then ultimately the withdrawal of care, where we're decreasing their frequency while also improving their overall musculoskeletal function by giving them more and more complex exercises. And then if they decide that wellness care is valuable to them, and we know there's strong evidence around wellness care, certainly for spine-related disorders, then that's great. They can come back for maintenance care. It's not something that we sell to every single patient. It's a matter of whether or not it aligns with their core values. We talk to them about dosing. This is those two charts down here, reduction in pain and reduction in disability. Those two charts came directly from the Haas study that looked at what happens when patients are treated more frequently. What we know is that patients get better, the faster, the more frequency there is in care. And then what we have them do is literally fill out what days and times they can come in on the scheduling sheet. We hand it to the staff to then schedule them. The patient's playing an active role in this. The provider obviously is guiding this discussion based on their own clinical experience and their own and their knowledge of the clinical practice guidelines and dosing studies. It is very evidence-based, and it's designed to get the best outcome in the shortest period of time. But ultimately, at the end of the day, because patients are scheduling out all of their visits at the beginning of care, that is a leading indicator of potential kept visits. We don't want to be chasing patients one visit at a time. And I mean, that's so cumbersome. We want to get their visits on the schedule. We want them to commit to a plan of care so they get the best result, and we want to be able to move forward. One thing that again, that's important to understand, if patients get better faster, we can reduce their frequency faster, right? We're not tied to those X number of visits that we've scheduled them out. And I say that because it's an ethical issue for me, right? Like the goal is to get patients better as quickly as possible. And we use the scheduling out process to get them to commit to a care plan. But if they're getting better faster, we're gonna get them done faster. If it's taking them longer, then we're gonna have to see them longer. Like that's just the nature of the beast in healthcare. So every single day, I get a report, my team gets a report as to how patients did or how our clinic directors did in scheduling out their full course of care. So this is Dr. Huffman's practice. This was last week. And this is exactly how all of his new patients, which is blued out right now for HIPAA, and how they scheduled out. And we see this and we have a calculated percentage. Our goal is 80% of patients scheduling out their entire course of care. We know exactly how each one of our providers and our patients are doing in scheduling out. This comes across our desk every single day. Every single day, we know, because we don't wait till the end of the week to find out how many of our patients scheduled out. We are managing by statistics, and it's incredibly helpful and successful for us. So other indicators are no futures, self-discharges, and then of course, gamification, which I'll get into a little bit later. Let's talk about no futures first. In the spirit of data, and this again, guys, it may seem cumbersome and it may seem like more work, but when we're not chasing our tail, it's significantly less work. Once you set up the infrastructure and the process, it happens quickly, easily, and consistently, and it's just done. But we can see every single day how many no futures we have on all of our clinics scheduled. So by the end of last week, we had 37 patients who did not have a future appointment. So that's well above the 20 that's well above, what do we shoot for? 32. It's 8 per clinic. So we're about 5 over. And so we know what steps need to be taken now with those people that have no future appointments. But it's much easier for us to do this rather than scheduling out at the beginning of the week. If you look over here all the way to the left, we knew that we had 107 patients that had no future appointments, 107 individual patients that did not have a future appointment that we needed to get scheduled. We knew it in advance of the week. And every single day it gets sent out, we know exactly how many no futures we have at the end of each day, so we can get them scheduled. This is discussed in the pre-shift huddle so that those patients can then get their appointments on the schedule. So again, these are leading indicators for kept visits, because when we get those future visits scheduled, we have a higher percentage of kept visits the following week. Doctor discharge versus self-discharge. This is a lagging metric. So we measure how many people self-discharge every single week. We also look at the percentage or the number of people that discharge at certain numbers of visits. How many discharge after 1 visit, 2 visits, 3 visits, 4 visits? We have a discharge by visit report that we run out of Genesis, and our clinic directors report on that every single week. And again, when they're doing this reporting, it's not just for me, it's for them too. They want to know where they stand. They want to know who they need to follow up with. But at the end of the day, self-discharges obviously decrease future visits. So, and therefore kept visits. So we want to monitor this. We want to understand what's happening with these self-discharges, and then take proactive steps along the way to drive a better result, move people more towards doctor discharge and less towards self-discharge. And then lastly, gamification. Now, this may seem a little abstract as it relates to kept visits, but we're a unique organization and we think about things in a very unique way. And one of the ways that we think about our business and our practice is to evaluate the literature and combine the scientific literature and technology. And so here's what we know. And we've looked at a lot. Jenna, who's our director of research and innovation, she runs the research division and operations on the technology company. She does a lot of other stuff too, but I mean, we've looked at the literature and we know that gamification and the use of a mobile app can drive care plan adherence, period, end of stories. There's at least 38 randomized controlled clinical trials that have demonstrated this. And we know, again, that gamification principles are closely related to principles that have been proven to work in health behavior change technology. If you think you're not in the behavior change business, you might want to think again, because everything that we suggest to our patients, everything that we do with our teams to delegate and elevate is behavior change. And so if you understand behavior change science, then you start to understand how we can move the needle with the use of technology. So we had a hypothesis that people love free stuff. So here's what we did in our practice. We built our own mobile app and we focused on a rewards program. Now, if I was live in front of you in the room, and I actually did this when I was speaking in Michigan at the Michigan Association of Chiropractors last Saturday, I was like, how many people in the room are part of a rewards program, like frequent flyer miles, hotel rewards? Literally every single person in the room raised their hand. Okay, so that's not like super interesting news, right? So people are in a rewards program, that's neat. But nobody's ever thought about instituting a rewards program to drive behavior change with our patients in chiropractic. But we did. We decided that we were going to build our own mobile app based on the literature and based on our own experience and based on other large companies that have done so successfully to drive adherence to the care plan. And so medication mainly. We've seen that in large businesses like CVS, but we wanted to do it for chiropractic and physical therapy. So we built our app and we built a rewards program. When patients come into our office, all they come in, they open up the app, they scan a QR code, they get a point. Once they reach a certain number of points, when they reach that milestone, they get an OIG compliant gift. It might be a branded item from Kaizo Health, or it might be something that ties directly to their care plan that's $15 or less. So the OIG says you can give a patient a gift, but it's got to be $15 or less and no more than $75 a year in aggregate for an entire year. What's the most popular screen on our app? It's the rewards screen. Go figure. And what did that do in terms of driving adherence? We looked at all of our patients between all of 2019, January 1st, 2019 through December 31st, 2020. Over 4,200 patients, 4,203 to be exact. And what we found is that on average, we drove an increase in visits by 36% for those who downloaded the app compared to those who did not. There is a statistical correlation between how our patients are using gamification and the number of visits that they attend for their care plan. This is meaningful. This is a behavior change technology that allows us to drive in a leading way better adherence to care plans. If patients are more engaged because they're enjoying the gamification piece and they're more adherent, are they going to get a better outcome? 100%. And that's what we're really driving towards, getting the best possible outcome. So we've done this with all of our customers. Nationwide, our customer base just continues to grow. And guess what? The most common screen is, oh, by the way, we've got over 12,000 users now. And guess what the most common screen is in using the app? Reward screen. This is behavior change, science and psychology, literally in data form. And the second most common screen, you guys, is the web exercise screen, the home exercise screen. And so we know home exercises in physical therapy and chiropractic the data is terrible, right? Patients don't adhere, but yet what you can see is that if patients are using their mobile device because it's more convenient, and we've done human-centered design studies to ask many patients these questions. They love doing the home exercise on their mobile device. Why? Because it's a productivity hack for them. They don't have to worry about whether or not they're carrying around their stupid exercise sheet or they're running around for 5 minutes trying to figure out where they left it. It's right on their phone. Where is everybody these days? On their phone. Some additional productivity hacks that came up with our customers because they're using the app and their patients are using the app, they no longer have to fill out exercise sheets. So if you want to save time and effort, and if you want to spare your staff the pain of writing out three sets of 10 reps over and over and over and over again every single day, use technology, because that's the feedback that we're getting from our clients. Also, if you want to save time and not have to save time and money by not having to order and or stock and or give out cards anymore, but you want to be able to have your patients refer a friend or a family member to your practice, guess what? They can do it right through the app. Because we built a refer a friend tile, and they can refer a friend through text, through email. And again, our customers customize whatever messaging they want. But the coolest thing is they can actually do it through social. So if somebody clicks on the Facebook or Instagram or Twitter or LinkedIn tile that's built into their app, they can actually send out a message tag the person they want to refer, and it goes out to their entire network and the person they tagged entire network. So we're talking about one-to-many strategic marketing and branding for your practice. You want to give out a card to every single person, or do you want to brand your practice through the use of technology? I mean, for us, it's a no-brainer. So again, gamification can be used to drive kept visits. We know it, there's data around it. We've seen it in other studies, and we've certainly seen it in our own practice and our customers' practices. So again, in summary, productivity hacks, planning. Again, guys, be prepared at the end of your week, go back, look at your week's past, look at what you need to accomplish that didn't get done, add it to the following week, both in terms of tasks and calendar items. Make sure that you've got consistent meetings that you need to have on the schedule as recurring items. And you could use Outlook, you could use Google, you could use Asana for task management. There's many, many productivity tools out there, but use them. 2, you want to build yourself as a leader and become a leverage contributor even more, because the more you communicate with regular one-on-ones with your team, the more you support and promote their education and their development and their success, the more you're going to be able to do your unique ability, what you love doing, what you're great at doing, and what's most important for your practice. 3, remember outsourcing. The things that you don't necessarily want to be or need to be world-class at, can you outsource it? Billing, HR, finance, marketing, or components of them. Think about that, because there's some really great companies out there that support what we do in chiropractic. And lastly, really understand the key drivers of results. We only talked about visits, but we can talk about new patients, revenue, profit, like so many different elements. But remember, understand, track your leading and lagging metrics, and really elevate your practice. Think about what chiropractic practices look like in the 21st century. It's about implementing technology to produce results at scale. So there you go. I know that this is a time for questions, and I'm gonna pause for a second, because here's what I'm gonna tell you. I want to answer questions related to the webinar and the content, but also I also know that this comes up at every time I speak. How do people learn more about the app? And so we'll talk about that. I'll share exactly how you can learn more about developing a custom-built app for your practice, that we've done many, many times over now over the last 1.5, 2 years. And we've actually got some special pricing today. But I want to just make sure that if there's any questions right now related to the content that I've provided, I can answer those questions. And for those of you that are interested in sticking around, I can just kind of share the app information with you, because I don't want to get away from just creating as much value as I can right now if you've got questions specifically related to the content. So I'll wait a few seconds. If there's anything in the chat, great. If not, I'll get into just, how you can have us build you a custom built mobile app. So any questions, you guys? I'm not seeing any come through right now, so I will get started. So we are going to do special pricing today. We've got some goals that we've set. We're trying to build our customer base so that we can impact more end users, impact more patients, and obviously collect valuable data on behavior of the end users, your patients, so that we can continue to evolve and develop the app and make it even better than it is today. So here's what we're doing. Today only, if you buy, what we're going to do is provide you with a 60% discount on development, which is, I'll get to the numbers in just a second. And I'm giving you a 30-day money-back guarantee, which means after we do your demo and talk about the development of your app, if you decide you don't want it, we're going to give you your money back in full, no questions asked. So you've got 30 days to get your demo call done. Usually we schedule it within about a week, so that's plenty of time. And then if you decide that you don't want it, no problem. But the reason why we're asking you to commit today is because we know how it is with Kairos. I know how it is with me. I go to an event, I see a great product. If I don't buy it then, it goes into the basket of, yeah, I'll get to it later. But if you really believe that this is going to impact your practice like it's impacted ours and the rest of our customers, just don't hesitate, make the decision to buy. And then if you're not happy or you don't think it's a good fit for you, I promise you, we will give you your money back. So for the first 5 doctors that actually purchased the app today, we're going to throw in some other things. So normally our development is $2,500. We're going to discount that 60% to $999. And the monthly fee, the maintenance fee, where we keep the app updated for you, any changes that we need to make, That's usually $199, and we're going to discount that as well to $149. So you're getting a 25% discount on top of the original 60% discount. Also, I'm going to throw in my free course. It's a 20-module course, 20 videos called the Chiropractic Entrepreneur Framework. It gets into great detail about building your infrastructure, some of which we've covered today, but we're talking about hours and hours and hours of content, where today I had a limited amount of time. So we're going to throw that in for anybody who purchases today. That's a $479 value. And I'm going to throw in 1 free hour of coaching for you. I charge $500 an hour. And so I'm going to throw that in as well. So all of this, 60% discount on the app, 25% discount on the monthly fee, the CEF course, the Chiropractic Entrepreneur course, the online course, that's also going to get thrown in for free, and 1 hour of coaching with me personally for free. All of that for $1,978. You only have to spend the $999 today, which is phenomenal. And you actually have a money back guarantee. So you're good to go. So again, if you're interested, scan the QR code. Jenna will reach out to you and we'll set up your demo call. Again, if you love it, great. We're going to build you a custom built app. We're going to drive greater care plan adherence. We're going to create convenience for you and your staff, which is a productivity hack using technology. And if you're not happy with it or you don't think it's a good fit, we're going to give you your money back immediately. So just to share with you some productivity hack all-stars, other people who have used our app. This is JP Yergel. He's out of Virginia, Fredericksburg. He generated 106 new patient leads in 6 months. All he did was promote the app, both online and offline, and he got leads coming into his practice automatically. He didn't have to do anything. He wasn't going out doing spinal screenings or chicken dinners. I mean, this dude was getting tons and tons, is still getting tons of leads through the use of the app. That is creating impact at scale. This is another friend of mine, Dr. Bibu Misra. I talked about the exercise sheets earlier. Like, his staff is elated. Like, they're so happy. They never have to give out literally another exercise sheet ever again. And their patients are using the home exercise plan significantly more through the app than they were using the exercise handouts. So they're getting a double whammy. Their patients are getting faster outcomes and they have less work to do. That's a productivity hack. And then lastly, another really good friend of mine, Dr. Alan Sokoloff, 2-time Super Bowl winning chiropractor. He's no longer giving out business cards. Like, those days are done. He's not spending the money on them. All he's doing is actually telling people to download their app. Hey, oh, you want to know more information about my practice? You know what? Pull out your phone. I'm going to have you download our app. There's all kinds of great stuff on here. You can take an assessment of your condition. We can give you free exercise videos that you can use based on that. We can have you learn more about us on social. You can check out all the content we have. Oh, and by the way, if you want to schedule an appointment, you can do that too. And, you know, we've had many conversations. We talk all the time, and this has been a game changer for him. I mean, when it comes to productivity for him and his staff and the ability to scale his impact and differentiate himself in the community, just taking his practice to the next level. So again, here's the QR code. If you're interested, scan it, make the payment. We'll set up a demo for you. And hopefully, if you feel like it's a good fit, which it has been for many, many, many chiropractors around the country and even in Canada, we're going to help you scale your practice and get you to that next level. If you guys want to connect with me, just feel free to email me at drj@kaizenovate.com. You can also check out our website. And that's what I have. And I know there's a couple of questions in the chat. So what do we got? We got Dr. Ellen, chicken dinners. Don't forget Yellow Page ads. Exactly. Ellen, you and I both know those old days are long gone. And thank you very much for your comments about the presentation. I really appreciate it. I want to thank all of you for joining today. We'll be back next quarter to share more information with you guys. And I just want to thank you all for being here today, and hopefully you enjoyed it. And feel free to give me some feedback. Like, if this was helpful, great. If there's other information that you'd like to see on a future webinar, just let me know and we'll make sure that happens. So appreciate you guys. Good luck. If you need anything, don't hesitate to reach out to me because I'm here to help support your success. Okay, everybody, have a great afternoon. We'll see you soon.